UK Healthcare is a 1,040-bed academic medical center in Lexington, Kentucky. We're a two-hospital system, both hospitals relatively close to each other, and we function as one integrated system between those two hospitals.
We serve central and eastern Kentucky as well as many of the adjacent states and provide specialty services for many of those patients. And the residency really benefits from these specialty services because they're able to see patients who require transplantation, who require advanced pediatric services or hematology oncology. We're a level 1 trauma center and a Joint Commission accredited stroke center, as well as for epilepsy, and we're an NCI designated cancer center. So all of those sort of checks in the boxes, if you will, benefit the residency program by providing a great deal of depth and patient experience that is very unique and difficult to get anywhere else in our region.
In total, we have 14 specialty residency programs, and I think we have now 32 residents. And coming into a huge program like this, I think what I didn't really expect was how close I would be to my co-residents and the long-lasting friendships and relationships that I would form.
The number of employees we have in the pharmacy department is in excess of 700. That's inpatient, outpatient. Our drug spend's about $300 million. So we naturally are involved in a lot of areas. You will find us on pharmacy committees. You'll find us on medical committees, really throughout the health system. We are a key player and people want pharmacy at the table because of the value that we bring.
When I was going through the residency search, I was really looking for a program that would continually challenge me and really help me to practice at the top of my license and learn as much as I possibly could to prepare me for the future.
I think one of the biggest things is just the sheer size of the department. When you look at the actual number of staff, both technical and pharmacist staff, we have a really deep pool of resources. So I think that adds to kind of the specialty areas that you see people kind of focus in, whether it be pediatrics, oncology, transplant, adult ICU, emergency medicine. I think that's one of the things as a department that sets us apart. Programmatically, I think that kind of parallels and bleeds into the residency program experience as well. You have a really deep pool of preceptors that can really enrich the residency experience.
One of the great traditions that really sort of helps build the network across residency classes is the R number. So every resident is assigned a chronologic R number, and at the beginning of the year they have a magnet with that number and they place it on a map of the United States that's located in our major conference rooms. And when they are graduating from residency, they move that number to wherever they get in a place of employment. So it's a great way to know where your R network is, and it shows that we value each and every unique graduate of this program.
Coming here as a resident sets you up for success. I myself was a resident many years ago, R265. Part of that, we've been able to build an outstanding team of preceptors. So we don't rely on a few individuals, but a strong group that has a lot of depth. It allows residents to gain exposure to a variety of care settings as well as specialty care populations.
Several of my mentors at my College of Pharmacy introduced the program to me, and one thing that stood out to me was just how often they mentioned UK's legacy. Looking back, I don't think I could have really comprehended what exactly UK's legacy would mean to me. What I think is different about UK is the legacy really just provides a framework and a really strong foundation for what it is that we're expected to do whenever we're here. I think that the most important thing that the residents do is not only meet the high expectations set by the pioneers of pharmacy like Paul Parker, but really rise above and keep pushing the envelope and make sure that the momentum keeps going.
When I originally decided to go into pharmacy, UK has always been at the top. They've always been in the top College of Pharmacy. When looking at residency and program training, UK was always at the top. UK was considered, for lack of a better term, an ivory tower of pharmacy. They've been doing it since the beginning.
UK Pharmacy Residency Program is over 50 years old, and it's a really special example of a residency program that not only treasures their legacy, but one of our legacies is change and innovation, and really pushing the field of pharmacy forward.
I would would say, honestly, the main advantages of being at UK for your pharmacy residency program is the quality of our preceptors, the opportunities that are available in terms of academia as well as research, and then of course having that strong pharmacy presence and tradition. There's really a lot of opportunities that are afforded to us that wouldn't normally be in a residency program.
The best thing about this program for me is the connections I make with the people, whether it's colleagues, peers who are my co-residents whom I love, or clinical pharmacists who are my preceptors and will always mentor me and teach me throughout my career, to the physician colleagues that I work with every day. It's a great opportunity to meet people who can teach you new skills, teach you new knowledge, and help you develop yourself overall, and that's what I really enjoy about this program.
So as a first-generation American citizen, it was important for me to train and work at an institution where representation of multicultural backgrounds was not only present, but really celebrated. In fact, the college and the hospital enterprise have really fostered an environment where diversity and inclusion are not only valued, but really necessary at each step of the way.
Must mention the on-call program, which is a wonderful benefit in terms of how I've been challenged outside of the realm that I would have been challenged at other institutions or in other residency programs. Some of the duties that we have with that, we respond to code blues, we respond to stroke alerts, we respond to giving factor 7 in the OR, or really any type of drug information question or blood cultures overnight. I think the biggest benefit for residents is that it really pushes you to be independent, pushes you to be autonomous.
In my mind, it just allows those pharmacists, which are residents at the time, to become fully ingrained in the care of patients. They are the primary contact for several hours of the evening and through the night, so they never really know what they might be contacted about. You learn a lot about yourself and not only your ability and your own knowledge. We don't expect them to have all the answers, but just the ability to work through those scenarios, know what resources you have, when to contact someone. We feel like those are skills that will help you throughout your career and sometimes even bleed over into life.
So I think the biggest benefit of the on-call program is really it puts you in those situations you wouldn't normally feel comfortable being in. And there's something really to say about being put out of your comfort zone and the person that you're able to grow to be, and those skills that you never thought that you had that you're able to develop and hone.
Our values are Living Direct, and it's an acronym for diversity, innovation, respect, communication, and teamwork. And the beautiful thing about UK Healthcare Health System and UK College of Pharmacy is that we live those values in our residency program. And the combination of UK healthcare, getting to see so many different clinical aspects of care, the College of Pharmacy, getting to partner in that teaching, education aspect, even that research aspect, there really is no excuse for not getting the fullest experience you could in a residency year. And really of all those values, my favorite value is innovation. And I think that UK in particular has a history of being innovative. We're always open to pushing innovative and creative ideas. And I think that you'll find that very true in your residency training here.